Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Jason here with us today. Jason is a Marine Corps veteran of over 18 years, correct?
Yes, sir.
We want to thank him for his service to our country and his sacrifices that he's made, along with all the rest of you veterans out there. Now, he retired from the Marine Corps after 18 and a half years, about right?
Yes, sir.
And he's 100% disabled according to the VA, correct?
Yes.
So he has fractured his right hip, which has messed up his entire pelvic alignment. He's got pain all the way down into his right leg and his feet, including numbness and tingling into his toes. He's also got mid-thoracic and upper thoracic pain, neck pain, migraine headaches, and bilateral shoulder pain. Have I missed anything?
No, that's about it.
That's plenty, huh? Okay, so let's show him how we're going to treat you today, Jason. I've already done his orthopedic neurological exam. I know a lot of you want to see that, but I'm not going to do all those tests every time. That's just too much. Joseph doesn't have time. I'm going to have you flex your head forward and backwards for me.
I'll take the blame.
And neutral. I will show you a couple of highlights of his test, though. Okay, so he's got a lot of what's called forward head posture. Here's the ears way out here in front of his clavicle. It should be back here over his shoulders. And that's what's making his shoulders kind of round forward, and he gets all that stress in his upper thoracic and mid-thoracic spine. But when you have forward head posture, it actually increases the weight-bearing compressive stress all the way down in this lumbosacral spine region, and the muscles and ligaments of the entire spine, paraspinal muscles, have to work out 4 to 5 times harder just to hold your head up in gravity. So one of the main things that I wanted to show you, go ahead and sit right here for just a second, face that way, Jason. These are a couple of really important orthopedic tests that we did on him. So when I brought his head back and to the right and pushed down, that causes pain in your neck and upper back, doesn't it?
Yes, sir.
And then we did the same. I'm not going to do it real hard because I already did this and it caused pretty severe pain. That caused pain in the same areas, right?
Yes, sir.
Now, this is a test that I ran on him to see if his spine was compressed. Lift his occiput straight up vertically. Did that ease off some of the spinal pressure?
Felt great.
Great, good. So we just check his muscles here. He's got 5x5 strength on both sides, and his reflexes were normal. So I'm not going to do those over. Let's go ahead and lay you on your tummy here now, Jason. We treat a lot of veterans here at Advanced Chiropractic Relief, and we appreciate everything that they've done, including Joseph, who was in the Air Force. That's how Joseph and I met. He came in here as a patient. Now see, he's got bilateral SI joint pain, and he's got L5 really bad right there. These are all sore down the lumbar spine, and the thoracolumbar spine, he's really tight bilaterally. He's got T5, 6, 7, and 8 all anterior, which means they've been down inside of the rib cage, and the ribs are sticking out more. Those are probably tender right there. And see, he's got super tight traps on both sides and rhomboids and levator scapula muscles. He's got C5, 6, and 7 rotated posteriorly on the right. And he gets those migraine headaches that start right here at his atlas suboccipitally and go up and around into his frontal region. He gets headaches with auras. Now we did a sacral deviation test on him. Go ahead and lift your right leg up. And see, he has a hard time just getting that up. Let's do the same thing on the left side now. And an even harder time getting that one up. So I'm going to adjust his SI joints first. And his pain is now what's known as chronic pain, which is a duration of over 3 months. You've been dealing with how many years now?
15 years.
15 years. Yeah, these are going to be a little sore at first, Jason. Not many people treat Marines like this and get away with it. There we go. Okay. I told you I was going to move your lower back. Yeah, good. You haven't seen anything yet. Okay, just relax all this.
Oh, God.
Okay, this is gonna be tight up here. There we go. I got several different adjustments I'm gonna do on you today. Now your legs are exactly even. The right one was short by ½ an inch. Does this feel any smoother than that first one at all?
Oh, yeah, a lot smoother.
Okay, good. So I'm gonna adjust your cervical spine here now. Put the curve back in. I'm sure you saw in your x-rays your cervical curve had straightened out. There, good. Okay, now let's turn you on your back, please, sir. Yeah, we're just getting started. That's it. Good. Now slide down this way a little bit and put your arms straight out to the sides, palms facing up. Okay. I'm going to adjust your shoulders, your clavicles where they attach to your sternum, and then your anterior ribs here, which are all out. That's it. Good. Now just relax your hands on your tummy there. And let me have your leg completely. Now he's had a completely dislocated fibula on the right.
Oh!
I just adjusted his right knee all the way up into his right hip and low back. Did you feel that in all those spots?
Yeah.
Okay. So you got ligaments instability in both knees. There you go. Good job. All right. Let's set you up. Face towards Joseph for a second. Now, I want you to come over here on this table. And I'm going to have you get on this table with your knees right there and your face and chest up in here. Okay, let your spine just kind of sink down in there.
Oh,
Hang on one sec. There it is. Okay, now come over here. Yep. That's the transition zone between your lower thoracic and your lumbar spine. That's a little painful at first.
God bless it. Yeah.
This one here is the one that's going to set you free, though. On your butt there, head up that way. Like I said, not too many people get by with this, doing this on Marines. But slide down a little bit more. You'll feel better when you walk out of here.
That sounds great.
I'll let you determine that for yourself, though. Now, this is your very first time getting this done, right?
Yes, sir. There we go.
Okay. This is the way you should sleep, by the way. Just like this. Now, nice deep breath through your nose. Keep your teeth together and relax.
Oh, my
Yep.
God.
Yeah. I have just one question. Did you feel that all the way down?
Yeah.
Okay, keep breathing. Yeah, look, you're still kicking. You're all right.
Oh, shit.
Keep breathing. First one's the worst one. There you go. Let this one go. There you go. Told you were going to get an adjustment.
I feel taller.
You are taller.
You're supposed to get a weird taste in your mouth.
Well, you may. It's affecting your entire autonomic nervous system right now. Come, let me help you up sideways. Bring your legs over this way and sit up sideways. You always want to get up sideways. Let's stand here in front of the mirror again.
Oh, my God, that's crazy.
Yep. Now, I'm going to have you flex your head forward and backwards again. Remember how this feels. It's already better range of motion, though. Back to neutral. Take a look in the mirror right now compared to when you walked in the door, though.
Yeah, straight.
See how you're squared off more?
Yep.
So here's your homework. Your head's still a little forward and your shoulders are still rounding forward. So you're going to bring your shoulders up, pull them back, simultaneously pull them back like that. See, your head's forward and to the right, so we're going to bring it straight back and to the left. Now look at the wall behind you. Way in extension. Feel a little tap right there. Another one on your atlas there. Now relax. Now when you flex your head forward and backwards again, Jason, tell me if this feels any smoother to you than the previous ones.
Yeah, big time.
Okay. All our YouTube fans out there always want to know what the very first time of getting the ring dinger done feels like, and I'm going to let you answer that question.
At first it hurts like hell, but right now I feel great.
Do you feel like it's
well
decompressed
worth
or
it.
something?
Oh yeah, big time.
Okay, good.
Yeah, I felt like I grew at least an inch and a half.
Do you feel better now than when you walked in the door?
Yes, lots better.
It's your very first visit, meaning to come, you're going to get well.
Thank you.
This is your Houston chiropractor, Dr. Gregory Johnson and Jason, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.